All right, I want to go in and just review module, where is it? Just review this week we're in. Okay, so I'm sharing my screen. Can everybody see that? Could anybody see that?
Yes,
Yeah.
we see it.
Okay, good. So we know what's due this week, right? Discussion question. You guys know about the discussion question. A lot of you have already turned it in. Just make sure you're answering the full part of it. Okay, it's asking you to identify 3 commonhood child ailments, and it's asking you to discuss signs and symptoms and develop a 6-point educational plan for the parent. Okay, and so let's see, initial discussion posts are due tomorrow night, and then your 2 peer reviews are due Sunday, right? And then NCLEX. Anybody having issues with NCLEX? Everybody figuring out NCLEX and how to get in your subcategories?
Yes.
Okay. And then is everybody working, or at least everybody knows what group they're in, right? For the Healthy People 2030?
Yes.
Everybody knows what group they're in. Okay. And everybody's hopefully starting to communicate with each other. Okay. So then for next week, we have the case study due and the exam. Okay. Okay. Anybody have any questions about anything so far? Are you guys reading through the material to some extent? Are you starting to understand some of the main components of community nursing? Okay. And just last question. Nobody has any questions from last week from orientation? Oh, somebody has a question. Wait, BC? Yeah. How do you pronounce your first name? I've already asked you.
Just call me Rebecca.
Rebecca.
Yes, ma'am.
All right, Rebecca. What's up?
Okay, so I'm wondering, the case study we have for next week, can you explain it? Because you said something like you were going to put us in groups.
Did.
So
I sent you out an announcement with all of the instructions and the group that you're in. Did you not get that?
What I've not really seen. I'm going to look at it because I've not, been able to know what group I am in. So.
I hope I didn't forget you. I don't think I did. Go back and look at, let's see, it would have been right here. Group project Healthy People 2020. So it would have been posted on the 12th. Right here. Let's see what, where's my groups? Didn't I give you guys groups?
Yeah, you sent
Yeah,
it in.
you
It's at
did.
the bottom of this. You have to.
Oh, there it
keep
is. There it is. There you are. You're in group 1. Or group.
Okay, I see. Thank you so much.
You're welcome.
Okay.
Okay.
Everyone.
Zalila? Zalila?
Yes.
Hey,
Yes.
are you, Ebony's here too? You don't have your pediatric?
I'm doing both. I have a laptop and an iPad.
Okay. All right. Cool. All right. Welcome. All right. All right, let's get going. So we're going to review these week 1, these chapters in the first up until, let's see, it would be 10 o'clock, and then we'll do the study guide the second hour. How's that? Are we all in agreement with that? Okay. And then I'm traveling later on today. So I'll be out of commission till probably tomorrow morning. I'm traveling over to visit my daughter over in the UK for a couple of weeks. So I'll be teaching from over there starting next week. But I should just be out of commission for like tonight. That's it. Tonight, I'll be back online in the morning. All right. So if anybody's any questions, just wait till tomorrow for me to answer them, but I'll be around. I can check it all day. Okay. All right. Chapter 1. What do we get out of chapter 1? Or what do we need to know in chapter 1? Okay. We definitely need to know the difference between community-oriented and community-oriented nursing and community-based nursing. Okay. Hang on. I'm just trying to pull everything up here I need. What's the difference? Who figured that out? This isn't going to be all me either. So let's see. It's right in your PowerPoint. Okay, so the one thing we need to know is the difference. Here's our objectives. Okay. The mission and the core functions of public health. Okay, discuss the role of public health nurse. Contrast community-based nursing with community-oriented nursing. All right, and then population health. So let's go into the book. Okay, because there is a, hang on one second, bear with me. There is, I need to put you guys down here. Well, we can start here, right in the PowerPoint on PowerPoint 3. Okay, it talks about the differences in community-based nursing, community-oriented nursing. Okay, the way I think of it, I don't know if this helps you, but the way I think of it is community-oriented. It's a big picture. Okay, typically community-oriented nursing is public health nursing. Okay, so it's a big picture. I think of it as you're orienting yourself to the community. All right, you're focused on promoting quality of life. You're focused on healthcare of the entire communities or populations. Okay, the goal is to prevent disease and promote, restore, and protect health for a community. All right, and I'm going to show you a box in the chapter in the book that breaks it out nicely. The focus of community-based nursing, and I think of community-based nursing as you're already in the community. You're community-based. Okay, you're already taking care of the ill in the community. Okay, focuses on illness care of individuals across the lifespan. Okay, so oriented, you're trying to orient yourself to the community, looking at the big picture, prevention, preservation, restoration, where community-based, you're taking care of the ill. Okay, I want to show this to you in our book. Let's see. Oh, where's the book? Okay. So here's our objectives in the book, right? So here's table 1.1 is an excellent summary of the differences between community-oriented and community-based nursing. Okay. Questions? Okay. Public health. Here's your definition of public health. Okay. Studies epidemiology, statistics, and assessment. Okay. We're always looking at behavioral, cultural, and economic factors that help us determine what the current health of your community is. Okay. We need to know what population health is. Okay. It's right here. Population health, or the health of a population as a whole. Okay, so population health, or health of a population as a whole, including the distribution of outcomes and disparities. Okay, we need to know this. You need to know page 4. What are the 3 public health core functions? It's one of the, it's the first objective. Core functions in public health. First objective, assessment, policy development, assurance. You need to read through those. Okay. We discussed the role of public health nurse and how the role influences practice in the community. Contrast community-based and community-oriented. We talked about that. And then the role of the public health nurse and population health. Did anybody, here's population focused nursing practice right here on page 6. Okay. So population health nursing is a specialty with a distinct focus in the scope of practice. All right. The role of the public health nurse has changed over the years. And so this goes through the last objective right here on page 5. Right. Oh, page 5, sorry. Describe the role of the public health nurse and nursing and population health. Okay, so here's that. I'm just curious as we get going here, just by show of hands, have you guys looked at these? Is this familiar information to you? Have you already reviewed this? Jamie? Okay, thank you. Anybody else? Because if you haven't, this is all brand new information to you. Okay. So, and I said last week, we have a lot to cover in this first hour. So hopefully it's a review, but if it's not a review, whoops. So is this helpful to go through it this way? Okay. Okay, so let's see what else we got going in chapter 1 that we need to know. Did you guys do the 2 exercises? The did you guys read through how you need to know Healthy People 2020? Okay, goals and objectives, overview and goals. Okay, I think I put this in an announcement. The things you should be reviewing for the chapter preparation are the objectives. And you always want to review the Healthy People 2020 box and the levels of prevention box. And we'll go through that in a minute. And then I sent you the answers to 2 of the learning exercises in here in these chapters. Okay, I sent you the case study. Did anybody go through and do the case study? I sent you the, I can only see a few people, so just speak out, please. Did anybody go through and do the case study with the attachment I sent you? Was it helpful? The rationales? Anybody? Did anybody do the case study? I'm just waiting for anybody to speak up.
You talking about the case study that have to be turned in for next week, right?
Nope, I'm talking about this right here in front of us, right here. The case study in
I went
chapter
over
1.
those case studies and the case studies that you sent via PowerPoint.
And so you did this case study in the book? Did anybody do this case study here on page 10?
I remember you mentioning that case study, and I haven't yet got to it, but I did plan
Yeah,
on.
Okay, all right. So if you haven't done the case study, I would do this case study. This case study I already sent you the answers to. It has excellent rationales. Okay. Answers can be found in Evolve. I already sent you the answers. Okay. And then here's our intervention. Okay, this is the first chapter related to levels of prevention. We talked about this last week. In every chapter, you're going to have levels of prevention depending on the topic of the chapter, will determine what the levels of prevention are. So this chapter, we're talking about public health. So these are levels of prevention related to public health: primary prevention, secondary, and tertiary. So primary prevention, as a definition, is education, prevention. It's primary care, primary prevention. Okay, when we talk secondary prevention, we talk about screening, early identification, early intervention. That's secondary. And then tertiary, they already have the disease, they already have the health issue. So we are trying to help them manage that. Okay, so let's go through these 3 examples. So in primary prevention related to public health, the public health nurse develops a health education program for a population of school-age children that teaches them about the effects of smoking. Okay, so that's primary. It's prevention, it's education. Secondary, related to public health, is the nurse providing tox screenings for migrant workers that may be exposed to pesticides. So we're trying to identify early any issues with migrant workers who may have been exposed to pesticides. Okay, and then tertiary, public health nurse provides a diabetic clinic for a defined population of adults in a low-income housing unit in the community. So the population already has diabetes. So we're trying to facilitate helping them learn about whatever the need is. So does everybody understand that? Primary, secondary, tertiary. We're going to cover that every chapter. This is just the introduction to it.
Isn't it technically like prevention, screening, and then helping?
Management.
Management.
What did you say for the last one?
Like management, helping. Okay.
That's exactly right. Education, screening, and management. Yep. Let's see. Here was your second. Did anybody do this exercise? Whoops. Anybody do this exercise, the practice application? I sent you the answers to those as well. So if you haven't, I suggest you do. Okay. So that's chapter 1. Let's skip to chapter 2, the history of public health. Okay. All right, our objectives. Okay, discuss what historical events that have influenced how current healthcare is delivered. Trace the ongoing interaction between the practice of public health and that of nursing, and significant historical trends. This PowerPoint is a good one because you don't so much need to. So here's your objectives I just read. Okay. Let's see, what do I want to tell you guys? The answers to these objectives in chapter 2, this is a good PowerPoint. They're all found within the PowerPoint. Okay, so I need you to review the week 2 PowerPoint. They're in the book as well, because remember, the PowerPoint is a outline of the book. Okay, it talks about early public health. Okay, you don't have to know every part of the history of public health. There are a few that you need to know about. Okay, you need to know about Lillian Wald and Mary Brewster here on slide 8. Okay, American Red Cross and Rural Nursing Service. The American Public Health Association, right here. You don't need to know when it was established, but why it was established. Okay. Okay, we really start to focus on the 1930s and after, okay, with public health. Okay. I'm just going through and pulling out what we need to, or what you need to. Okay, Healthy People 2020, it started in 1979. Okay, we'll need to know that. We'll need to know about the National Center for Nursing Research, NCNR. Okay. There's not a lot covered on the exam with chapter 2, but there are some points that let's see, let's go in here real quick. Chapter 2 is actually really cool to read about the history of nursing. There's Lillian Wald, box 2.1. Okay. Right here, here's what you need to know. You need to know what the public health during the early 20th century. So there's two areas that you need to know about. One is what were frontier nursing services and what were they used for? Okay. And the second one is frontier and just a little bit above that. Let's see. Oh, the American Public Health Association. Okay, so you need to know the differences of what the functions are for the APHA and frontier nursing services. Okay, you'll definitely need to know that. Okay. Yeah, this is just full of history. There's not a lot of expected knowledge on the exam, but there are definitely a few things. So again, read your objectives, and I gave you a couple of points of essential knowledge that you'll need to know within that chapter. And we'll go through the questions. Okay. History of public health. Okay. Okay, changing chapter 3. Let's go into chapter 3. Changing U.S. healthcare systems. Changing U.S. health and public healthcare systems. Okay, so objectives here, right? What has anybody got to chapter 3 and looked at the objectives? And can help out here and be interactive? No? So if you haven't, you guys have some work to do with preparing for the exam. Let's see what you need to know here. I would definitely suggest, I'm going to find the Healthy People 2020 box and the Levels of Prevention box, because we need to know that. Okay. There's a lot of information in all these chapters. I'm really trying to focus in on what is essential knowledge. Please read through the section of the current healthcare system in the United States on page 37. Okay, with regards to the cost, access. Okay, here's your case study. Excellent case study. This is an excellent case study with, I've sent you the answers and the rationales. Okay. So we're looking at, I want you to read this section about current healthcare systems with regards to cost, access, and quality. Okay. And then read through this section, the organization of current healthcare system. What do we have? We have a primary care system. Okay, so that was the question. Remember primary care? That was a question last week in one of our attestation questions. So here it is right here. Okay. So how do we organize our current healthcare system? We have a primary care system. We have a public health system. And you don't need to, you just need to know the systems we have. Okay, you don't need to know all the details about each system. Federal system. Okay, so those are the three we have. Systems. Here's our levels of prevention. You can see It's related to the public healthcare system. So every week we do levels of prevention. They're different based on the topic we're covering. And this is related to the public healthcare system. So our primary prevention is the implementation of a community level program, such as walking for exercise, to assist citizens in improving health behaviors. Okay, so that's education, prevention. And then secondary would be to implement an example of secondary. There's plenty, but they identify implementing a family planning program to prevent unintended pregnancies. Okay, so early intervention, early detection, screening. Okay, and then tertiary provides self-management asthma program with kids with chronic asthma. The kids already have the asthma, so we're trying to help them manage it. Okay. Here's our Healthy People 2020. Okay, only 2 objectives to know about. I always tell students to put the levels of prevention and the Healthy People 2020 on a little index card to help you remember them, because you need to know them. We don't necessarily ask questions about every chapter with levels of prevention and Healthy People 2020, but it's not every chapter, but there's a lot of questions about Healthy People 2020 and levels of prevention. Okay, so you have to know the Healthy People 2020, but you have to understand the levels of prevention. So you should be able to, with whatever topic we cover, once you get comfortable understanding the levels of prevention, you should be able to come up and think about a primary level in each chapter we go through, a secondary intervention in each chapter we go through. You have to be able to apply that to all the different topics. Make sense? Okay, here's our, oh, not there, sorry. Here's our practice application. Has anybody had a chance to do that? This is a good one. Do your practice application. I've already sent you the answers with the rationales. Okay, I've already sent you your practice application and case studies for all of these chapters. Okay, so that's 3. And then the big one we get to is chapter 21. Okay, chapter 21 starts to really give us a feel for, let's see, where's part 3? No, sorry. Need to get to chapter 21. Okay, chapter 21, vulnerability and vulnerable populations. Okay, this is heavily represented, okay, on the exam, on all the exams, because that's what we talk about pretty much all term, is public health, vulnerability in the community, and who are the vulnerable populations. Okay, so 21, okay. So your objectives, define, again, go back and look at your objectives, define who the vulnerable populations are, what led to the development of vulnerability. You can read through the objectives, but you should be able to articulate the objectives. Okay, so let's go through the chapter. And this actually, chapter 21's PowerPoint is an excellent PowerPoint. So make a note of that. Make a note to go through the PowerPoint. And we'll do that in a minute, but this is a big chapter. Okay, so here's all your objectives right here. Okay. So what is vulnerability and what are vulnerable populations? Right off the bat, page 357. There's your first objective. Right? To you guys, what is in your community? What are vulnerable populations in your community? What is vulnerability? I'm throwing that out there for you guys to answer. Go ahead.
Elderly, children.
Poor.
homeless. Who else?
Yeah, we
Uh,
have a homeless community right here in Jacksonville. It's a lot of cities nationwide that have been transporting their homeless from their major metropolitan cities to ours.
Yep. What about addiction? Substance abuse? Do we
Yeah,
consider,
the mental ill community.
that was my next one, mental illness community, substance abuse, addiction, homeless. What about our vulnerable teen pregnant moms? So when you start start to look at your vulnerable populations assignment that's due in week 9, this is a good chapter to go through. Because your paper's about vulnerable populations. This is a good chapter to go through. So, okay. So vulnerability, as a definition, right, is your susceptibility to actual or potential stressors that may lead to an adverse effect. Okay. Vulnerable populations, those at risk for developing adverse health outcomes. Do we think that vulnerable populations are more at risk for adverse health outcomes? Sure. And why? Why would they be more at risk for developing adverse health outcomes? Me coming from the schools, I think of kids. Okay. If families in my schools are homeless, right? The parents and the kids have an increased of developing adverse health outcomes. Like what? I don't know, lack of immunizations, lack of healthcare, lack of education, lack of nutrition services, right? So here's a couple of box 21.1 is a good start. We've talked about a lot of these, but for identifying certain vulnerable populations. Veterans, we hear about them, pregnant adolescents. And remember, if you get asked about, if you have a question that says, I don't know, select all apply, who is a vulnerable population? Students in the past have got kind of tied up on this. Pregnant adolescents are considered, for purposes of this course, vulnerable populations. When it says pregnant people, pregnant women, that's not considered vulnerable. Okay, it's the pregnant teens. Okay, so please make note of that. Okay, we talked about mentally ill, substance abuse, victims of violence, right? People with communicable diseases, people with HIV. Okay, here's our Healthy People 2020, and their objectives, just like their levels of prevention, are on the topic we're covering. So Healthy People 2020, has anybody get into the Healthy People 2020 website and looked at that website? It's really, if you haven't, I would suggest you do. Go in and peruse it. It's really, really, really good. But here's their objectives for vulnerable populations. Okay, because that's the topic we're covering. Right? So you need to know those. Put them on a card. Okay, and then let's, okay. You do need to know about social determinants of health, determinants. Okay, social and economic factors contribute heavily to vulnerability. Okay, that's really important to know. Social and economic factors contribute heavily to vulnerability. Okay, what is a determinant of health? Okay, economic status, education, environmental factors, nutrition, stress, prejudice can all lead to poor health, and increased health risks. Okay. What's poverty? Poverty is a primary, note this, put this down, because this is gonna come up several times. Poverty is considered the primary cause of vulnerability. Okay, so for purposes of this class, we talk about poverty, financial health as having a direct impact on the health of the individual, the family, the community. Okay. We don't really need to know this. I'm just skipping through it. Okay. Okay, this is just kind of an FYI, but box 21.2. These are some of the nursing roles when working with vulnerable populations. These are some of the hats we might wear as a public health nurse working with vulnerable populations. Okay, look at all these different roles we might play. Okay, so have a look at box 21.2. Okay, and here's our levels of prevention related to, we're in the chapter of vulnerable populations. So have a look at this box. Okay, we're not going to go through it because I want to keep going. I have a few more chapters to cover, but go ahead and read through. I definitely read through these levels of prevention box for chapter 21. Okay, it's on page 367. Okay, this is a good box. It's on page 367, how to assess members of a vulnerable population. How do we do it? Create a comfortable, non-threatening environment. Learn as much as you can about the culture. Okay, so this how-to box is an excellent box. Okay, whoever has a TV in the background, can you mute yourself, please? All right, let me stop sharing here and I'm going to mute it. Who needs to be muted? Is it Brandy? Who else? Everybody else muted? That do it? Okay. Okay. Planning and implementing care for vulnerable populations. What's important? Creating a trusting environment, showing respect, compassion, and concern. Do not make assumptions. This is where, here's your case study. For those of you, this is an excellent case study as well. I sent you the Evolve Answers and Rationale. So if you haven't, take a look at these case studies. Okay, it has excellent rationales, and that's where a lot of where you're going to learn from. Okay, this is where I have my little talk about I'll stop sharing just so I can, what are your beliefs? What are your attitudes? What are your values? You know, when you're working in the community, you're working with vulnerable populations. What are your beliefs about homelessness? What are your beliefs about people with HIV? What are your beliefs about teen pregnancy? So you have to be able to kind of do a self-check as you're caring for these kinds of populations in the community, right? Because in order to care for these, you need to create a trusting environment, show respect, compassion, do not make assumptions, coordinating services, advocating. Okay, so it can be really hard to work with the vulnerable populations. How do we intervene with them? You can read through that. Okay. Let's see. Case management we do a whole chapter on case management. Case management's real big with vulnerable populations. Anybody have an idea of what case management is? What do we do with, what do nurse case managers do? They're kind of the organizers of care, right? They coordinate the care. So let's say you have a vulnerable population, let's say you substance abuse and addiction. They're probably going to be much less likely to coordinate their care, their therapy, their rehab, all those things, because they're so impacted. So the nurse case manager in the community will work with that. Okay. And then practice application. Here's your practice application on page 371. Again, it's hands-on, it's like case study. Go in and do this. I already sent you the answers with the rationales. Okay. And I want to go back to chapter 21 PowerPoint. Chapter 21 PowerPoint is excellent. Okay. So defining vulnerability, health disparities, who are our vulnerable populations? What are the factors contributing to vulnerability? Outcomes. Excellent, excellent PowerPoint. Okay. Okay, any questions so far? I'm going to jump into chapter 18. Has anybody, well, I should ask it this way. Has anybody gone through week 2 information? Anybody gone through the PowerPoints? Anybody gone through the objectives for week 2? Done any case studies? Done any practice applications for week 2? Okay. So week two covers family assessment. It covers family health risks. It covers health risks across the lifespan, and then the nursing schools. The chapter I really want to focus on, the chapter we're going to focus on is health risks across the lifespan, which is chapter 20. There's a lot of content on the exam from this chapter. Okay, from chapter 20. It's health risks across the lifespan. Think about it. What does that mean? As a community nurse, you're going to be caring for people across the whole lifespan. You're going to be caring for newborns. Well, you may be caring for newborns. You may be caring for toddlers, infants. So you need to have a good look at chapter 20. Okay, because what are the risks for infants? And we'll cover this in the study guide. SIDS. What are the risks for adolescents? Accidents. Right? What are the risks for teenagers? Motor vehicle accidents. You need to have a general knowledge of each of these populations, if you will. The elderly, falling, risk for abuse. Okay, so I'm going to jump into the PowerPoint. I'm going to jump into chapter 20 PowerPoint. Okay, so let's go through this. Okay, it's right in the objectives. Health problems with children and adolescents. Measures to promote child and adolescent health in the community. What are the risk factors? They're different between men and women. What are the risk factors for older adults? It's all about risk. Okay, risk factors for persons who have special health needs. Okay, so you potentially are going to be caring for any one of these clients. All right, and here's your categories: children, adolescents, adults, older adults, special needs. Okay, and this is an excellent PowerPoint too. So what are some of the children's major public health issues? Here they are: obesity, injuries and accidents, developmental, child abuse, maltreatment, mental health, chronic health. Right, so what target areas do we want to maybe do some prevention with regards to that group. All right, smoking, nutrition, prevention areas, teaching about environmental health and immunizations, nutrition, smoking. Okay, we need to know about these. Okay, health policy legislation, you are going to get asked, let's see. You're going to get asked a question that says, here's your scenario. Here's your scenario. Is this a scenario that we would use Americans with Disabilities Act? Is it Patient Self-Determination Act? Is it Family Medical Leave Act? And so you need to go back into the chapter and get a one-sentence summary of what each of these are used for. Okay, I can tell you right now, Americans with Disabilities is the protection of people with disabilities. Patient Self-Determination Act is patients have to have everything in writing. Okay. Advanced directives, that's where living will, power of attorney. Family Medical Leave Act protects employees and going out on a leave to take care of themselves or a family member. And then the Personal Responsibility and Work Opportunity Reconciliation Act. Okay, this is the Age of Families with Dependent Children, temporary assistance for needy families. So you need to know that you can put that on an index card. Go back into the book and get a one line, 2-line definition of what each of them represent, so that you can identify, when you're given a scenario, can identify which it applies to. And then we have legal and ethical issues related to older adults. Okay, that's one of the groups you're going to be studying, is the older adults. What are some of the legal and ethical issues? Well, decision-making, right? I mean, if an elderly person is deemed competent, we want them participating in their care, in their decisions. They need to be autonomous if they're deemed competent. Okay, so we need to learn about ethical and legal issues in regards to who's making the decisions. There's a National Center on Elder Abuse. You need to know that exists. Okay, so major health issues and chronic disease management of adults. Okay, so have a look at this PowerPoint. Okay, continued chronic issues of adults. Okay, there's 4 slides on that. You don't have to memorize everything, but you need to know, what are some men's health concerns? What are some women's health concerns? Okay, you'll get asked about identifying, pick of the group of answers, pick one that is a chronic disease concern of women's health. Pick one that is of men's health. So you need to have an idea of what these are. Okay, men and women. Health disparities among special groups of adults. Okay. Adults of color, incarcerated, LGBT, mental disabilities. These groups have health disparities amongst them. And then family caregiving. We do a little bit about family caregiving. So that's a big chapter. Okay. Not that the others aren't important. Chapter 18, family development, we'll go through that in the study guide. How do you do a family? Chapter 18 is how do we do a family, where is it? Family development and family nursing assessment. Okay. So again, if I'm trying to simplify it for you, just if you can just be aware of how to articulate these objectives, that's where your studying should come from. Okay. And Chapter 18 goes through family nursing in the community. What's the definition of a family? Okay, what family functions are there? What are the functions within a family? Economic, reproductive, socialization, affective, healthcare. Okay, you may get asked a question, select all that apply that are family functions. What are family structures? You know, is it a married family, single parent family? Okay, what's family health? Theoretical frameworks for family nursing. I bet you didn't think there were theoretical frameworks for family nursing, but there are. Okay, so a lot of great information. You just have to kind of review. You know, there's not enough time in these classes to cover everything of every chapter, which is why I try and help you guys do a more focused, targeted studying, right? So let's review before we get to the study guide. So here's what I think you should do, at least for the chapters, to just review the objectives. Make sure you can answer or articulate the objectives. Okay. I would start to find the answers to the objectives in the PowerPoints, since the PowerPoints is an outline of the chapter. If you can't find it in the PowerPoint, it's in the chapter. Or, yeah, it's in the chat. For sure, it's in the chapter. Okay, but try and get your information from the PowerPoints. Okay, the other thing I sent you along with the PowerPoints is another case study. Okay, I sent you along these case studies. Where are they? I sent you along all these case studies. We just don't have time to go through them. So for example, chapter 20, health risks across a lifespan. I sent you all these. Okay, these are excellent. These come from me, my Evolve. This is part of the lesson plan that is given to me through Evolve. And so I like to pull out all the case studies, because there's a good amount of questions that come up on the exams that are taken from these particular case studies. Okay, I'm fine with you having the answers. I want you to have the answers, right? So here's your scenario up here. There's your question. Here's your answer. And the most important thing is this rationale. Okay, so review the case study I've sent you along with the PowerPoint. I'm really trying to hone it in for you. Okay. And then I would certainly suggest you review the practice application that came from student resources, the answers for the practice application, and the case study that's in your chapter. So there's two different case studies. Does that make sense? There's the one I send you from my lesson plan every week, that we pull exam questions from those case studies. Does that make sense? So objectives, PowerPoints, the case study I've sent you from the lesson plan, which is the purple. Okay. And then I'll keep until I know everybody's getting their student resources in Evolve. I'm going to continue to send you the answer sheet for the practice application and the case study in each chapter. Those are student learning activities. They don't give you the answers in the book. It says go to Evolve and find the answers. So until you have that all sorted out, I'm going to send those to you. And I'm telling you, if you guys do that, study the study guide, you'll be in the 90s in the exam. I promise you. This isn't a hard class. It isn't. You just have to stay on top of it. Okay? Does that help?
Yes.
Trying to help you guys out as much as I can. Team effort. Okay, study guide. Pull out your study guides if you have them in front of you. So here's what I would do for study guides. I told you this last week. Here's what I do. We're trying, we had to rewrite exams 1 and 2. And so we just got finished with study guide 1 and we're working on 2. I like you to have the study guides in the first week that the exam is going to be covered. So exam 1 is covering weeks 1 and 2. I like for you to have the study guide at the beginning of week 1. Okay, so for exam, I know Dr. Lundy's working on the study guide, I think for exam 2 already. I want you to have the study guide for exam 2 at the beginning of, even though it's week 3, week 4, week 5. Week 3 is exam week, so we won't start covering content till week 4. Sometime during week 3, I want you to have the study guide for exam 2. Because what I like to suggest that you do is go through the study guide after each class and highlight, check off what we went through. Because technically, I like to use the study guide to prepare my lectures as well. So technically, you should already, everything you're reading on the study guide should not be new information. I should have covered it, or at least covered the topic. Does that make sense? And so if you're going through every week and just clipping off that study guide, checking what we went through, then you know that everything's covered. All right, does that make sense? All right, study guide, everybody. So we already know the chapters it's going to cover, right? 1 through 3, 18 through 21, and 31. So you got 8 chapters, just like your other exams. 50 questions, multiple choice, select all that apply, math problems. I sent you guys some math resources. Anybody taking a look at those so far? Helpful?
Yes.
Okay. Let's see, 1 through, I think 1 through 40, 46, 47, 48, 49, 50. 1 through 45 are questions, and there's 5 math questions at the end. Like 46, 47, 48, 49, 50. Okay, in there, general math, IV calculations, determining equivalents, conversions, medication dosages. Okay, they're not trick math questions. They're not complicated, they're not trick. Okay, they're basic math questions. All right, so if you have a basic understanding of math. Now, have you guys taken pharmacology? Okay, good. Okay, I already knew the answer to that, because typically the students coming into community do excellent in the math sections. Excellent. So let's see, review math handouts, do practice questions. I've already sent you all that. Case studies. So it's just giving you ideas to study, case studies, practice applications. Okay. Remember safety first. What is the priority? Prevention levels relate to each chapter. And then the ADPI. I don't even think I've mentioned ADPI, but ADPI. Okay, so Healthy People 2020, you got to know level of prevention for all the chapters. But the other thing is ADPI. Okay, when you guys think of ADPI, you think about assessing a pediatric patient, assessing an OB patient in the inpatient setting. Okay, you have to, by the end of this class, you should be able to successfully apply your ADPI to the community setting. Okay, so when you do an environmental assessment, a family assessment, a community assessment, environmental, we need to be able to take the ADPI and apply it to community. So what does assessment look like in a family assessment? It looks a whole lot different than assessing an adult patient in the hospital. Okay, so we need to be thinking ADPI completely, what's the word? Completely applies to community and public health nursing. It's just set up differently. Right? An assessment in the community setting looks different than an assessment in the hospital setting. Then looks different in an assessment in urgent care or in a migrant setting. But AdPi, we have to be able to think of how AdPi is going to be set up in the community as well. Okay. Levels of prevention, Healthy People 2020 must be reviewed. Look at the tables that were highlighted in the lectures. We just went through that. Okay, so full disclosure, it's not an all-inclusive study guide. Best practice to prepare for the unit exam is to review your notes. You're here, so recordings. If you will have the recording. It says review interactive lectures. There's no more interactive lectures. I don't know why that is still in there. We'll get that out. But there's no interactive lectures. Review readings, projects, and discussions. Review Zoom weekly sessions, attend an exam review, which this is why I do it like this, because I didn't have a lot of attendance when it was an outside, like you had to go for an extra 2 hours above and beyond the classes. That's why I'm doing it today. Okay, so it's broken out into key community concepts. Okay, so every bullet could potentially be a question. I don't mean the same bullet, but the information, the topic, the concept. All right, so you have to understand each bullet. Okay, so we broke it out. First is priority and safety assessment. All right. Key concepts we're using is AdPi, safety, and delegation principles. Okay. And it right off the bat, it starts giving you information. Talk about SIDS, right? Risk factors. Has anybody read through the study guide yet?
Yes.
Are things starting to make sense from the study guide as to what
Yeah,
we're
because
going
when I
over?
first looked at it, I didn't really understand it. But when you broke it down like that, it's much easier.
Yeah. Exactly. All right. So interventions, review. I'm just going through a review 2020 principles on safeties for adolescents. Okay. Look at violence, motor vehicle issues. Remember, these are the leading causes of morbidity and mortality for adolescents. So just from that third bullet, what kind of question might you get? Remember, these are
Which
leading
bullet, Professor? Which one did you say? I'm sorry.
I'm on the third bullet on page 2, where it goes through principles of safety for adolescents. And it gives you information. It says, remember, these are the leading causes of morbidity and mortality. So what kind of question might you get?
Maybe like something, maybe
Like
something
what to be
that's it.
concerned about with an adolescent, like topics that would be of concern. Yeah.
Yeah. Or what's the leading cause of? Right? It's right there. What is the leading cause of morbidity and mortality for adolescents? What is it? Motor vehicle accidents. Okay. Next one, safety assessments. Know what environmental things you should look for when assessing common areas in the playground. Ooh. Know what would put your child at risk. Priority intervention, safety and recommendations. I forget what chapter this is from. I believe this is from chapter 20. I think there's still a question on the exam. Go back and look through playground safety. There's a little box in chapter 20. Let's go look. That talks about the role of the nurse. So let's assume in the community, they've asked you to help with the planning of building a new playground. Okay. And they say, what should we do and what shouldn't we do? Hang on. Why can't I get here? Oh, there we go. I think chapter 20.
Yeah, it's on page 338, box 20.3.
Oh, who did that for us? Danielle. Okay, Danielle just gave you where to go. Danielle, can you repeat that?
Yeah, it's box 20.3 on page 338.
What do we say to Danielle? group.
Thank you.
Thank you.
And that's what when I do these study guides for all of you that have already been looking at them, anything you can do to help with the rest of us is great. All right, so you're going to be you're asked a question like, I don't know if it's what should you do or what shouldn't you do? It's one of the other. So just know that we don't want, does this say anything? This doesn't give any specifics. Go back and look at that box. Like, we don't want any pointy, we don't want any ropes, we don't want there's 7 or 8
Metal
criteria.
slides.
What?
No more metal slides.
Well, if you look at the box, you know what you can and can't do. So you will get a question on playground safety. So next one, Healthy People 2020 recommendations regarding gun violence and safety. Okay, so here's a potential question. How would a community nurse assess and teach families primary prevention principles with regards to these 2 key concepts? What are the 2 key concepts we're talking about? Violence and safety. I'm a highlighter, so I'll just go and do that. All right, so you need to go back into your chapter or PowerPoint and read about so for example, let's say you're going to do a home health visit and you're assessing safety, violence and safety, and you ask the family, do you own firearms? If the answer is yes, what do? What's your next step? Well, you need to go back and
See
read
where it's stored.
see where it's stored.
All parts have to be stored different places.
Exactly. Locked up. Yep, exactly. Excellent. Let's see. Next one, tertiary prevention. So tertiary, remember, management. How does this come into play when doing planning of care for children diagnosed with a chronic condition? Look at how the community nurse would make recommendations to assess interventions. Okay, so from this, I gather, so the kid already has the chronic condition, right? So we're trying to help the parents manage that. So what are good behaviors from the parents? What are bad behaviors from the parents? So for example, let's say we have a very complicated kid and they have lots of medical appointments, right? We need to ensure that this parent has the resources to get this kid to all these appointments or in-home therapy or whatever. You know, what if a parent, this came up last term, what if a parent tells you, oh, don't worry, I rescheduled that. Don't worry, I rescheduled that, because they don't have transportation, whatever. Is that an issue? That is an issue because we want the kid with chronic health conditions getting to appointments. So that's what that's about, right? Tertiary prevention. We are in a position to assess whether this family is functioning and able to take care of a family member with lots of chronic conditions and lots of needs. Okay. Review concepts of prevention when it comes to smoking. Okay. Smoking in children diagnosed with chronic conditions. So we're talking probably asthma. Okay. What do we do with a family that the adults smoke in the house? Okay. Education, right? Offer resources, smoking. The other thing real quick is community and public health nurses have to have a bank of knowledge, a bank of resources, because you're always referring people anywhere and everywhere in the community, right? I mean, think about it. If you're caring for people across the lifespan, you have to have a resource bank that is like no other because of all the referrals that you do. Right? I just throw that in there because that comes up as well. So tertiary prevention, review concepts of prevention when it comes to smoking. What are you going to do? How would a community do a primary and tertiary intervention? Think about the ADPI and prioritization. How would you create a nursing plan that addresses things like asthma? So think of that bullet in the ADPI. How would you do an assessment, a family assessment of people, of when you're doing a family assessment? What if the adults smoke? What if the kids have asthma? Okay, well, think of your ADPI. You've done an assessment. Okay. You go through the whole ADPI planning, helping the parents plan on how they're gonna either stop smoking or do it differently. What are they going to put in place, your intervention? How are you going to evaluate it? Okay, so there's a perfect example of a family assessment with smoking adults and kids with chronic asthma. Okay, how would you create a nursing plan that addresses things like asthma? Okay, understanding the difference between primary, secondary, tertiary level. Okay, so we've talked about that. Be able to distinguish between three and know examples of each. And I can tell you the HESI at the end of the term is heavily focused on primary, secondary, and tertiary. So you have to be able to identify primary, secondary, tertiary with each different topic. Okay, the next section is acts and organizations that play a role in public health. Okay, we talked about this. FMLA, right? Americans with Disability Act. Okay. Review the focus and history of frontier nursing. We talked about that. Okay, what are the quality and safety education for nurse competencies? What are the main objectives? That is in, oh boy, where was that? That's back in the, there's a whole box that I highlighted about that. Let's go back real quick. Where am I trying to go? It's in the book. Let's see. I think it's in here. I have it highlighted somewhere. I don't want you to spend a lot of time looking for that, so I'm going to find it for you. Was that it? No. No, wasn't there. Healthy people. Right here. Here you go. Okay, page 11. Okay, here's your competency definitions. Okay. Client-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Okay, so that's your book. That's right here. Okay, it's 1, 2, 3, 4. It's your 5th bullet on page 2 at the bottom. Okay. And then definitely the next bullet, knowing the center for, so in public health, you're going to get asked in public health, what is the main agency that we focus on to get our direction, our guidance, our what have we been doing the last 2 years? Who's been directing the pandemic?
CDC.
Right here. Yep. CDC. Okay. So this is this is a good bullet to know. This one is important. Okay. Because it gives you a couple of definitions. It gives you what the definition of the CDC is. It gives you a definition of the WHO, World Health Organization, which is international, supports global health. It gives you the definition of the NCHS, and then the Institute of Medicine. So this bullet gives you 4 definitions. So what question might you get asked? You might get asked, here's your scenario. Which agency would be dealing with it? Would that be the CDC? Would that be the WHO? Would that be the Institute for Medicine? So you need to probably put on a card if you want, just a quick definition of each of those. Okay. Okay, this is important. What's the difference between advocacy and social justice? You need to know that. We definitely need anything on the study guide you need to know. Okay, and I don't mean word for word. I mean topic and concept. So we all know what advocacy is, right? We all know what social justice is. Here's your definitions. Primary goal of public health. What is the primary goal of public health? That's one of our objectives. Okay, back in, I think, chapter 2, the prevention of disease and disability. Okay, yeah, this is back, chapter 1. This is public health nursing is population focused. Right? Here's your what does the public health nurse do? That's one of your objectives. Here's your answer. Okay, so the objectives are following along with the study guide, which is following along with the exam. Make sense? I can't connect the dots any more simply than that. Okay. Public health policies create health standards which decrease mortality. Okay, this is important because these are big statements. Public health policies have created health standards which decrease the mortality related to communicable diseases. When you see big statements like this, the leading cause of mortality is shifted to chronic diseases. What kind of question might you get? And in this question, please pick the one reason mortality is shifted, or what is it shifted to? Right? Shifted to chronic diseases. And why is it shifted to chronic diseases? People living longer, medication, technology, right? And here's another pretty big statement. The increase in the number of older adults and increasing population has created a challenge for public health nurses. So what about a question? What are the 2 factors that create the biggest challenge for public health? What are they? Right here. Increase in the number of older adults and just increasing in population in general. Here's another good one. Okay, lots of information in this study guide. Population of the world is increasing. Why? Increased fertility rates and decreased mortality rates. People are living longer due to advances in healthcare. We just talked about this. Okay, so maybe a question. The population of the world is increasing. Why? What's one factor or 2 factors? What are they? Increased fertility rates, decreased mortality rates. Are you with me? Okay, how do we manage care across the lifespan? Okay, unless the patient, we talked about this, is declared incompetent, the patient should be able to have the right to self-determination, which includes managing their own finances. Okay, so let's say, I'm just reading through this. This is a good summary of community-based and community-oriented nursing right here. Okay, really good summary. So let's just say unless a patient is declared incompetent, what this is referring to is managing care of the elderly. Elderly are very at risk for abuse, financial abuse, emotional abuse, psychological abuse, physical abuse, right? And so we want to make sure that whoever's caring for them is doing it in good faith. For example, if an elderly couple is deemed competent, why wouldn't they be able to participate in their finances and their decision making? You know, what if you have an adult child that moves in with them and says, don't worry, I'll take care of all the financing? Well, might that raise a red flag if they're deemed competent? I mean, you just don't know what people's intentions are. Does that make sense? And that's part of your assessment, your family assessment. School nursing, you can review that section right here. You can go through that. Family assessment, home visits, interventions, primary, secondary, tertiary. Let me just, I'm sorry. I'm going to go back to this real quick with school nursing, because it says, think ADPI. So just because I'm in the schools doesn't mean I don't apply ADPI. You know, with kids that come into the clinics, I need to do my assessment. I need to identify what's going on. I have to come up with a plan, put that plan in place, and then evaluate it. Okay. Review. So here for school nursing, it says review Healthy People 2020 objective for school nursing. So that potentially tells me that there may be a question with regards to the goals and objectives of school nursing in chapter 31. So that would tell me, oh, I better know that box of Healthy People 2020 in chapter 31. And what question it might say, in reviewing the goals and objectives for Healthy People 2020 with regards to school nursing, please select all that apply of goals that are listed. Okay. Okay. Primary, secondary, tertiary in the schools. I don't know. Let's talk about obesity. Primary, I don't know, maybe getting in the elementary school level and talking about the adverse health effects if you become obese, trying to prevent it, right? Maybe secondary is you go in the schools and do screenings, BMI screenings, you know, who's at risk? Who's at risk for becoming obese? Early intervention, early identification, that's secondary screening. And then tertiary, maybe you have a group of kids that are already obese. Okay, what are we going to do to help them manage or lose weight or whatever? Okay. Which ailments, if presented with various ones that a child could present to the school nurse, would take priority over the other? So obviously, remember your ABCs, right? What are your ABC? What's ABC?
Airway, breathing, and circulation.
Mm-hmm. Yep. Takes precedent over all psychological complaints. Okay, next section, family assessments, home visits, interventions, primary, secondary, tertiary. Okay. This bullet identifies what is the family crisis. Okay, this next section is Maps and Genomes. Okay, we didn't talk about that today in our quick review, but this gives you an excellent, right here, gives you an excellent summary of each of them. Okay, review what an map and what a genome provides with regards to assessment. How are each valuable to the community nurse to identify risk factors? Okay, well, genomes are histories. Okay, So they're genetics. Okay, so they give health providers the tools they need to use a person's unique genetic information. So it's that graph. It's the interviews you do, and you go back 3 generations, right? Who had heart disease? Who had alcoholism? Who had something hereditary? Okay, and it helps families understand some of their health risks, right? That may be associated with their genetic makeup. Does the family have a history of cancer? Does the family have history of heart disease? Okay. Okay. And the other one is ecomaps. Ecomaps are current. All right. They provide what is the social structure? What's the family's relationships that they have with others? Family, neighbors, community. What are their connections? All right. So I've used the example, all of us had huge ecomaps before the pandemic, right? Or I'll speak for myself. I had a huge ecomap before the pandemic. Family, recreation, friends, social, whatever. It's your connections with other social units, okay? So my ecomap, church, school, work clubs, organizations, all right? So my ecomap was huge before the pandemic. Well, what happened when the pandemic came? What happened to my ecomap? All my connections and social connections and things I did all went away, right? So ecomaps are a good assessment tool that we determine the family's connections with other social units, right? An ecomap, it's right here. An ecomap represents the family's interactions with other groups and organizations. What has happened now with the pandemic, with everybody's ecomap shrinking significantly, right? We talk about depression, isolation, no social contact, or limited social contact. Think of what it's done to our kids. All right. So that's the difference between genomes and ecomaps. Okay, understand why home visits are the best assessment. See, when you go into a home visit, you can do all your kind of assessments. You can do physical assessment of the living conditions. You can do an environmental assessment, you know, with elderly. Do they have rugs all over the place that are slipping? Is there furniture everywhere that they're going to trip over? And that's why they say that home visits are the best kind of assessment. Okay, and that would be in chapter 18 or 19, family health risks. Okay, but home visits are the best kind of assessment for a community nurse. It does have advantages and disadvantages. How do you overcome barriers with communication? Think about going into, you know, a neighborhood that may have a high crime rate. You know, what there's a box in, it's either an 18 or 19. Go find it. It has safety, personal safety. Maybe Danielle might have already found this. It's personal safety for doing a home visit, what you do and what you don't do. Okay. For example, don't bring jewelry with you. Do it during the day. Make sure you position yourself between the patient and the door in case you have to get out. Check in with your agency at the end of the day. Those kinds of things. So do we want to go back and try and find it, or has anybody found that yet? Can somebody just, who's up, who's has the chapters open? I think it might be in chapter 18. Just go through and find that little blue box that said it's about personal safety. Okay. What priority things must a nurse do in order to evaluate the family to get the information they need? Well, think of ADPI, assessment, evaluation of families. They're evaluating the nurse. Too much Scale family. Yeah, so this bullet is all about establishing trust. Okay, remember, when you go into the community and you're doing home visits, whether they're voluntary or involuntary, you got to establish trust. People aren't really willing to give up a whole lot to strangers. So you've got to kind of slow the process right here, slow the process down and build trust. Okay. Okay, here's one. Review table 19.2, phases and activities of a home visit. Okay, so do that. Okay, and then family, what's a definition? The next one is what's a definition of a family? Okay, what's the definition of family structure? Okay, there's a difference. There's family structure and there's family function. Okay, so that's what this bullet is, the difference between family structure and family function. Family structure is, what are the roles of everybody in the family? I'm the mom, you're the dad, you're the kid, you're the dog, you're the grandparent. That's structure. What are our roles? Where functions are in your PowerPoint. It was economic function, reproductive function, psychological function. There are 5 of them. Okay, so that bullet is knowing the difference between family structure and family function. Okay, and then this is important. What are the characteristics of a healthy and unhealthy family? Okay, function and dysfunctional family. Okay, that is in your PowerPoint. And I'm thinking that's in chapter 18, family assessment. There's a couple of questions on the exam, on each of the exams, I think, that identify, you know, what is a functional family? What's a dysfunctional family? How do you identify dysfunctional family? And what do we do for interventions? Okay. Oh, here it is. Page 302. 18.5, page 302, home visiting safety tips for nursing. So Danielle, I don't need you to go back and find it for me. We just found it. Okay, review healthy 2020 for parenting. Here's what we need to know about that. What were the goals? We're listing them right here for you. Review Healthy People 2020 objectives specific to parenting. I'm thinking that is going to be maybe still in chapter 18. Right here. What are the objectives? Here's a couple of them. Increase the proportion of parents who use positive parenting and communicate with the healthcare provider about positive parenting. So, okay. I think this is our last section, vulnerable populations and health risks. All right. Vulnerable populations are groups of individuals that have increased risk developing adverse outcomes. We talked about this. Vulnerable populations have several combination risks that make them more likely to develop disease and complication. Okay, here's examples of our vulnerable workers. We've already talked about some of these. Homeless, mentally ill, substance abusers, veterans, migrant workers. Okay, here's that big statement. Poverty is the primary key to vulnerability. What question might you get with that? What is the leading cause of vulnerability, or the leading indicator? What is it?
Poverty.
Poverty. Okay. Next one talks about primary prevention. Is an example of primary prevention would be to give a influenza shot. Right? That's primary. And then here's a nice little summary of secondary and tertiary. So read through those. And then when intervening with the vulnerable populations, it's important for the community nurse to set reasonable goals based on what you collect. We set goals collaboratively with the client, right? Because we want to try and empower them. We have to be culturally sensitive, right? It's important to have our clients focused on teaching, health promotion, disease prevention, self-care. For example, teach homeless individuals how to read their own TB skin test. Give them a self-addressed stamp card and they can return it by mail with the results. I know there's a question about this last one. Services that have increased impact on the population include those that focus on your socioeconomic determinants. What are they? Two of them: poverty reduction, improved education. So what you may get a question that says, what are the two most important socioeconomic determinants that impact the population? What are they? Poverty reduction, improved education. All right, tell me what you guys are thinking. Helpful?
Very.
Great, thank you.
Mhm.
I feel like I understand the study guide a lot better now.
Oh,
Um,
good, good,
Like
good,
after
good.
looking at it, I like reviewing it on my own. I kind of was like, oh, some of this seems filled in for us and some of it seems just like a guide per se.
Mhm.
So I was kind of like not stressed out by any means, but wondering, man, like how much of this do I really need to look into versus how much is right here in front of me? And I have a much better understanding of like what I need to dive into better
Mhm.
or research more on my own and some of what is really just on paper for us here.
That's an excellent assessment. I'm just reading a few things here to make sure I've covered. So again, we've covered a lot of ground today. If you focus on the study guide, the case studies, the PowerPoints, if you understand the study guide, you'll be absolutely fine on the exam. I'm not telling you that's all to study, but that's a good starting point going forward. Okay, so if you read a bullet in the study guide and go, what did she really mean? Go find that information and just read up on it, just to get more understanding. But we try and really focus, really hone in the essential knowledge, because it's impossible in this term with a 2-credit class to talk everything about community nursing. I mean, the book is 600 pages. It's not gonna. So we try and pull out the important concepts. Okay, so if you think levels of prevention, Healthy People 2020, think your ADPI, think your ABCs, review math, understand the study guide. So go back and do an inventory of the study guide. What check off? I got that. I understand that. Whoop, I better go back and look a little bit more about that topic. That's how I would do it. But again, I really felt the need to do this hour of review. That way I was assured everybody would get it, because in previous terms, you just didn't have the time to go to an extra 2-hour review. You just didn't, and people didn't. Very little. And so I had my idea last term to just the week before an exam, spend the last hour going over the study guide.
Well, I think it was very helpful and thank you for that.
You're welcome. Do you guys have any questions? Well, you know how to reach me if you have any questions, okay? Shoot me an email, shoot me a text, whatever. So again, I'll just be out of commission this evening when I had take my flight overnight, but I'll be right back online tomorrow. Let's see. I'm in Denver. So from the East Coast, it's 5 hours ahead. So this class to teach over there will be at like 2 p.m. But don't worry about it. You can still email me, do whatever you normally do. I'll respond, whatever. Okay. But just know overnight tonight, I'll be heading over. So I fortunately have a son who's a pilot for Delta. And so I have nice flight benefits. So I can go over and see my grandbabies whenever. So I think this is like my 3rd trip over there in the last 4 months. So it's pretty sweet. Yeah. So I'm going over to see Vivian and Harry, who are 6 and 3. So, and apparently the issue we have going on is Vivian has her first loose tooth. And she runs around from everybody because my daughter wants to pull it. So I told her I'll pull it when I get there. And she goes, don't come, don't come. So anyway, I think that's my first level of business is focusing on pulling out a loose tooth. Anyway, I told her yesterday, I said, you know, if you don't pull it out, I guess it's hanging out by a thread, that you're going to swallow it. And she started screaming, crying, and rah, 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 rah. And my daughter called me. She goes, what did you tell her? I guess I told her she was going to swallow it. She goes, stop. Just don't even talk about the tooth anymore. Done. So anyway, well, I hope this has been helpful. We covered a lot, but I feel good about what we covered. And you guys will do fine. I'm telling you, this is not hard. Just prepare the best you can with the study guide. And if you need additional information from the study guide, you know where to find it for more knowledge. But don't overdo it. That's the other thing. Don't overdo it. Don't go back and start reading 8 chapters. Don't. Please. You'll get too overwhelmed. Stay on the topics that are in the study guide and the objectives, because the exam is built on the objectives and case studies. There's a reason the objectives are what they are. What are objectives? They pull out the main points of chapters. Okay, so don't stress about this, please. Don't. You're going to be fine. All right, you got other things to focus on as well, and I realize that, and I acknowledge that, which is why I'm trying to help you out as much as possible. Okie dokie. Parting words.
Thank you again. And the attestation.
Oh, shoot. Do we have time? Shoot, what time is it? Oh, 8:54. Okay, let's go. Well, actually, what are the questions? I'm not going to go back and share again. What are the questions? Everybody pull up their attestation. Thank you. Somebody want to read out loud what the 2 questions are?
Define primary, secondary, and tertiary.
That's easy. What are they?
Primary is education, secondary is prevention, and tertiary is management.
Yep. What did you say secondary was?
Prevention, screening.
Screening. I like to call secondary early identification, early intervention, early identification, which is screening. Helps me understand it better if I say it that way. And then tertiary is management, rehabilitation, right? They already have something. You know, maybe they had a stroke and you're working on rehabilitation, or they have diabetes and you're trying to help them manage it. So, okay. So that's primary, secondary, tertiary. Everybody have their attestations pulled up. What's the second question?
Give an example of each one.
Oh, okay. So give us, what's an example of a primary?
Would that be primary, like for like peds, would that be your yearly checkups, your annual checkups and stuff like that? I know they check up more than that.
Yeah, primary care. Yeah. It's an annual, yeah, trying to prevent anything from happening. Yes. Or an education program, like we said, in the schools for prevention of obesity. Okay. And then what would a secondary be?
Is it like mammograms to detect like breast cancer?
Yep. I was going to say health fairs to do screenings, but that's perfect. Mammogram, perfect. And what about tertiary?
It would be like something if a person had a stroke, like do stroke rehabilitation.
Yep. Kids with diabetes, adults with diabetes, maybe doing a clinic, helping them manage better. Kids with asthma. You know, I come from the school background, so, you know, having an education plan in place to help. Education can be part of tertiary too. The kids already have asthma, but yet you're educating them on how to help them take care of it. So everybody put those answers in there and hit submit. And again, I want to just give you guys just kudos for your professional development plans. They were just awesome. Future nurses, they were awesome. Okay, so did I stay within our time frame this time? Oh. All right, I'm off to the airport, so I'll be in touch. And I figured out how to get my email and my module to my phone. That's big for me.
That's huge. Yeah.
Big
Yeah,
for
that's
me.
good.
So I can just pull up my phone, pull up my email, pull up the inbox. Like if you guys are sending me a message in the inbox, not to my email, I can see those. So that is huge for me. I just don't know if it will work over there. And the reason I had to set up my ExamSoft last night was because that's the one thing I don't have access to over there is ExamSoft. My Dr. Lundy will send me the results, but all I have to do is send you the code now because it's all set up. So we're good there. What else? I think that's it.
Have a safe flight.
Oh, I will. Thanks. Yeah, this is my father always comments from back in Boston. You go to London like I go to the grocery store. But anyway, it's the only way I can see my grandbabies. I do have my third grandbaby on his way. He'll be here in April and he's a stateside baby. He's right down the street. So I'm excited about that. Okay, enough. You guys go do what you need to do. In fact, if you have a few minutes, maybe go through the study guide now and just check off what you don't need to worry about and highlight what you need to go back and look at. Well, it's all fresh in your mind or at some point today. That's my suggestion. But you do what you want to do. Okay. All right. Everybody have a good day. Good week.
I have a question.
Yeah. You know what? Hang on one second.
I just want to find out how soon you can send us the recording.
Yeah, 1 second. Oh, the recordings I get. I'll get a recording in about an hour. And so then I post it in the announcements, just like I did last week. So week one recording is in the announcements from last week. Right? You guys all got that, right? In case you want to review it. So I probably will do this in the next couple hours. I'll send you the recording. Okay. If anybody has any other questions, stay on. I'll stay on. Otherwise, everybody, bye.